Thank you. Good afternoon, everyone. I'm from the cardiology division of the University Hospital of Siena, and I am carrying on this project under the mentorship of Professor Cameli, which I thank, and also in collaboration with the immuno-oncology team of our center, which I also thank. So, sorry. It is known that immunotherapy by immune checkpoint inhibitors is gaining importance for the treatment of cancer, thanks to its lower side effects compared to conventional chemotherapy. However, in some cases, this may cause myocardial damage among the lower side effects, and these may reach 1% of patients. This is mainly characterized by myocarditis, acute myocarditis, in other cases by pericarditis, heart failure, arrhythmias, with potential life-threatening consequences. So there is a timely need of reliable tools to provide early diagnosis and also early treatment to these patients. Basic echocardiographic indices like left ventricular ejection fraction, which is our common language for multidisciplinary evaluation, of course have the main role for the detection of cardiotoxicity. However, our guidelines, our European guidelines, also mention the use of biomarkers and speckle tracking echocardiography, which is an advanced technique which I'm going to present, for the detection of asymptomatic cardiotoxicity by chemotherapy or immunotherapy. Speckle tracking echocardiography is an high-sensitive, quick and available tool to identify cardiac damage by conventional chemotherapy. In fact, it was recommended in class 1 by our international guidelines with the main parameter GLS, global longitudinal strain, for to be used in patients undergoing chemotherapy. It is also useful, it is also shown to be useful for the diagnosis of myocarditis, although the gold standard parameter for imaging remains late gadolinium enhancement by cardiac magnetic resonance. To date, there are few data over a large scale for the use of cardiac imaging in patients treated by immunotherapy. So, speckle tracking echocardiography is a new technique, although it is present since 15 years ago, so not so new now. And it is based on the analysis of conventional grayscale echocardiographic images by a dedicated software, which is now available also on the echocardiographic machine, so it is very available everywhere, and it provides the analysis of myocardial deformation with the contour of left ventricular wall. So it generates the deformation curves of the left ventricle in the three apical views, echocardiographic views, and the average of the maximum myocardial deformation in these three views provides the reference parameter, which is global longitudinal strain, and which is our reference for every cardiac evaluation. So, to date, in literature, there are few studies about the use of global longitudinal strain in patients treated by immune checkpoint inhibitors. However, this showed that the use of global longitudinal strain, either alone or together with cardiac magnetic resonance, provides a good diagnostic power for cardiotoxicity by immune checkpoint inhibitors, and also provides prognostic information in these patients. However, as I said, there is a lack of large-scale data on it. So our aim was to assess the diagnostic value of speckle tracking parameters for ICI-related cardiotoxicity in means of ICI-detected myocarditis by CMR, cardiac magnetic resonance, and also to assess a potential correlation between speckle tracking variables and CMR variables, so to increase its diagnostic value. As secondary endpoints over a long-term follow-up, we will identify the best predictors among clinical, biohumoral, ECG, echocardiographic, basic echocardiographic and advanced echocardiographic parameters, and also CMR parameters in our cohort. So I am going now to present the preliminary results of our analysis. To date, we enrolled 76 patients referred for therapy with immune checkpoint inhibitors and without previous cardiovascular diseases. The majority of them is affected by skin melanoma. Then there are patients with lung and pleural cancer and neuroendocrine tumors. Most of them are treated with PD-1 inhibitors and CTLA-4 inhibitors. Sorry. If we look at the characteristic of our population, the average age is 67 years. Most of them are male, and if we look at the cardiologic symptoms, there are few patients with the cardiologic symptoms like angina, syncope, or dyspnea, and 1/3 of them are treated by a cardiologic therapy, such as ACE inhibitors, maybe more for hypertension, arterial hypertension. Then, looking at the biomarkers, these are within the ranges of normality, so hemoglobin, creatinine, renal function, hepatic function, they were all normal. And then assessing parameters over the conducted follow-up of 7 months as an average, we identified the absence of significant variation of basic echocardiographic variables, which were left ventricular dimensions, left atrial dimensions, right ventricular dimensions, and also diastolic function and arterial pressures, pulmonary arterial pressures. These were almost unvaried over our follow-up. While concerning speckle tracking echocardiographic parameters, we noticed a significant variation only of the left ventricular longitudinal strain, so the strain of left ventricular chamber. We also performed the right ventricular and left atrial strain, so the only parameter which varied was left ventricular strain. Although this remained within the lower normality ranges, since it is a parameter which varies according to age and sex. So this is the normality table which showed the normality ranges, and minus 17 is within the ranges of normality. Then we registered 15 events, 15 deaths, only one for cardiovascular causes, and 2 acute myocarditis following immunotherapy. These were diagnosed thanks to a troponin raise, high sensitivity troponin raise, and a segmental reduction of global longitudinal strain, which was globally and segmentally reduced, as you may notice, so minus 15 and minus 12. The important and interesting thing was that the segmental reduction of global longitudinal strain was correlated with cardiac magnetic resonance findings of late gadolinium enhancement. So the reduction of global longitudinal strain and late gadolinium enhancement had the same localization in both cases. Sorry for the suboptimal quality of the second MRI. Then we performed a secondary analysis of global longitudinal strain variation from baseline and after immunotherapy, removing from our cohort 2 patients which developed acute myocarditis, and we noticed slight raise in the mean value from -17 to -18, although there was always a significant reduction of global longitudinal strain, but always within the ranges of normality. So we are more confident to carry out these therapies. So, as preliminary findings suggest, we may conclude that the early recognition and characterization of myocardial damage by immunotherapy would be crucial to provide to these patients early treatment, early cardioprotective treatment, in order to avoid the disruption of therapy and poor prognosis due to the tumor. So our results suggest that GLS, speckled tracking echocardiography, may be useful to provide early diagnosis of cardiotoxicity by ICIs, also compared to the gold standard for the diagnosis of myocarditis, that is CMR. And as future perspectives, we aim to increase the sample size in order to confirm or disprove these findings, and also to carry out the prognostic endpoint, to have more prognostic information. Thanks for your attention.